Welcome to NHA Today, where we explore the path to lasting health and fulfillment through a whole food, plant-based lifestyle. Each week, we bring you real conversations with doctors, health experts, and everyday individuals who've transformed their lives through food, mindset, and community. This is NHA Today, powered by the National Health Association. Hello, friends. Lend me your ear and let's raise your health IQ. Hi, it's the champion Chuck Carroll from the Exam Room Podcast, brought to you by the Physicians Committee. But this is the NHA Today podcast, guest hosting today. And today we are talking about a condition that affects literally tens of millions of people around the world. This is not a condition that is exclusive to the United States, although you could say the standard American diet plays a huge role in the number of cases around the world. And there's a reason why I'm wearing a hat today that says never give up. It's because even though after being diagnosed with this condition, millions of people feel lost with it, the fact of the matter is there is still so much that can be done. And today we have with us somebody who's an expert in just that. We're talking about diabetes with Dr. Roxie Becker, my colleague and my friend from the Physicians Committee. Dr. Becker, thanks for being here.
Good to be here on a new podcast today, Chuck.
I know. We're making new friends. This is pretty cool. Yeah. I guess let's start with this. I mean, the prevalence of diabetes, the rates just continue to climb. Where do we stand right now? What do the projections show?
Yeah, so in America, it's about 1 in 10 people that have type 2 diabetes, and it's in the top 10 leading causes of death around the world, I believe it is. Certainly in America, in South Africa too, and in a lot of other countries. I just gave a talk at the Sri Lankan Lifestyle Medicine Conference this morning, and we spoke about diabetes, and even in Sri Lanka, it's the 4th leading cause of death there. And unfortunately, it is on the rise. And something that's particularly scary is that type 2 diabetes, we typically see it as a condition that affects adults, but now we're starting to see even kids, even teenagers, get type 2 diabetes. And so it is on the rise. It's something that is very important to be aware of, especially if you're a physician and you're seeing patients, because whether you're in internal medicine or surgery or pediatrics, you're going to be managing people with type 2 diabetes. And for anyone that's not a healthcare professional, this really is a message of hope that we hope to share with you today, because it's not a life sentence. I was taught in medical school that it's irreversible, but we now know that type 2 diabetes is reversible and it doesn't have to be your future. So we're going to talk about what actually causes it and what can you do to help give yourself the best shot at going into remission.
Now, back home for me in Southern Virginia, diabetes seemed to be something that was passed down like a recipe through the generations. And there just seemed to be that genetic component for what they called the sugar. How much of the person's risk of diabetes is actually attributable to their DNA that they've inherited?
I love that it's called sugar there in South Africa. I often hear it referred to as sugar diabetes. But there was a large study that estimated, based on data from 184 countries, that around 70% of cases of type 2 diabetes are due to a suboptimal diet. 70%. So yes, genetics runs in families, but what else runs in families? Our eating patterns, our exercise habits, what we do with our free time, whether we're sitting on the couch watching TV or if we're actively engaging in our community and having active hobbies. And what's quite interesting about that study, to go back to diet, is that while 70% of cases can be attributable to a suboptimal diet, the number one dietary factor there was getting insufficient whole grains. And I know that is going to come up because people think, oh my goodness, rice? I can't eat rice if I have diabetes. Turns out that things like millet, brown rice, quinoa, all of those whole grains, quinoa is actually not a whole grain, but all of those whole grains are linked to a lower risk of diabetes, as is fruit, as are vegetables. And so all of these foods that are high in carbohydrates, that people are told to stay away from, could actually be the key to preventing and improving diabetes. So just because your mama had it and your dad had it does not mean that you have to get it as well.
You know what else that means? It means that Wilford Brimley was ahead of his time. He was, and I'm sure that you're unfamiliar with who Wilford Brimley is, but Wilford Brimley was a famous actor who was a diabetes advocate in the late 80s and early 90s. And he, told people check your blood sugar, check it often, but he was also a pitch person for Quaker Oats. And I thought that that was like really kind of unique, especially given the fact that, as you said, so many people stay away from carbohydrates after they've been diagnosed. So let me ask you this. If it's not the carbs that are the issue, what then is driving up a person's blood sugar? What is the issue here really in their diet?
That's the million dollar question, isn't it? And we have a diabetes webinar support group that we run every Tuesday at the Physicians Committee for free. Anyone can join it, really. And we always say if we know what is causing something, we know how to fix it. So that is why it's so important to understand that type 2 diabetes is not a problem of eating too many carbohydrates. The problem is that our body cannot handle the carbohydrates normally like it should be able to. So at the cellular level, type 2 diabetes is a problem of insulin resistance. Now, to get there, there is this whole idea of a personal fat threshold hypothesis, and it's really, really interesting. So, if you've heard of Dr. Barnard speaking about type 2 diabetes, he talks about this whole accumulation of fat inside the muscle and the liver cells. But I'm going to take a few steps back before I get to explaining that. So, the personal fat threshold hypothesis states that people accumulate fat in their subcutaneous tissues first. So subcutaneous fat is if you pinch your skin, your arm, your thighs, your stomach, that fat that you feel between your fingers, that's subcutaneous fat. Once those stores are full and we've stored a lot of fat there, well, then our body starts to accumulate what we call visceral fat, and that is fat around our organs, deep inside our abdomen. And we start to accumulate ectopic fat in our muscle and our liver cells. Now, it's really interesting because overweight and obesity is linked to type 2 diabetes, but for any given BMI, you have some people who have diabetes, some people who seem perfectly metabolically healthy. So the personal fat threshold hypothesis is that for everyone, it's going to be at a different body weight, a different BMI, a different body fat percentage when we start to switch from storing our fat in our subcutaneous stores to storing fat in our visceral fat and our muscle and our liver cells. Why is this so bad that we store fat in our muscle and our liver cells? Well, the first thing is that in our muscle cells, so let's actually, before we get there, let's talk about what should happen, and then we'll talk about where this goes wrong. So what should happen when we eat a meal that is rich in carbohydrates? Think a bowl of beans and rice or a bowl of oatmeal and some fruit. We break down those carbohydrates into glucose in our intestines. That glucose gets absorbed, our blood sugar levels rise, and as they rise, they signal to our pancreas, hey, you need to release insulin because sugar in the blood is no good to us if it can't get into our cells where we can actually use it. So insulin comes along, it binds to its receptor on the cells, and it signals to the cells that they need to insert these little channels into their membrane so that glucose can get from the blood into the cell. When we have this excess fat sitting inside our muscle cells, it kind of acts like chewing gum in a lock. So instead of insulin unlocking the cell to let the glucose in, that fat now disrupts all of the beautiful reactions that should happen inside the cell after insulin binds to its receptor. So insulin comes along, knocks on the door, binds to its receptor, but that fat says, nope, we're not going to let these channels open the cell to let the glucose in. So in muscle cells, they become insulin resistant. Glucose can't get in, so we can't use the glucose for energy. In liver cells, the same thing happens, but there's a second part to this. So when we're in a fasting state, our liver produces glucose, right? So if we're sleeping, we're not eating, our liver produces glucose to keep our blood sugar level stable so we don't pass away in our sleep. And so when this fat accumulates in liver cells, our liver cells can't regulate that process and they actually can't turn off the glucose production as well. So now you're having rising blood sugar levels because that glucose is not getting into your muscle cells because they're insulin resistant. The liver is pumping out more and more glucose because it's not being told to stop. And in our pancreatic cells, which are meant to release insulin, they also don't like this fat. And so they start producing less insulin and it all becomes a recipe for disaster. faster. But the good news is this process can be reversed. It's not too late. So that was a whole mouthful. I'm sorry. There was a lot of information there. I get
No,
really
no, it
excited
is.
when I talk about this. So you can just cut me off if I'm talking for too long.
No, it's clear, like, absolutely you're passionate about it, and it just reminds me of like how complex of a machine the body actually is. Like, everything has its job, everything has its function, and they all need to work in harmony, in conjunction with each other, work properly in order for us to be healthy. I do wonder though, like, so you're describing type 2 diabetes. How does this differ from type 1 diabetes, who, that's still pretty common, but seems to be less um, driven by a person's dietary pattern? What's the difference there?
Yeah, sure. So couple things. Type 1 diabetes is different, but people with type 1 diabetes can also become insulin resistant, just like we see in type 2 diabetes. So while type 2 diabetes is a problem of being insulin resistant in your cells, and your pancreas has to produce more and more insulin to try and counteract this insulin resistance, type 1 diabetes occurs when there is an autoimmune reaction in the pancreas. So those cells die and are unable to produce insulin. Now, type 1 diabetes is not reversible, like in the case of, or unlike in the case of type 2 diabetes. But the issue is that if people with type 1 diabetes do not look after their health and are not following a healthy lifestyle, they can also become insulin resistant, just like in type 2 diabetes. Why is this a problem? Well, that means that they are going to need to inject more and more insulin as they get older, as they become more insulin resistant, and they will be more at risk of complications of type 1 diabetes. So even though the two diseases are different, they can have similar outcomes and complications, and both of them need to be treated with diet and a healthy lifestyle.
All right, now let's talk about that diet and that dietary intervention. I've grown quite fond of that term, a dietary intervention. It just seems so holistic and natural and fun, and good things from that. All right,
It
so
does. I like to call it a lifestyle because, people don't really like to start a diet, and it's a diet just comes across as seeming a bit more short term. So I like to call it a lifestyle
I
change.
got you, but
Well,
if you add if you add airy after diet, like, it makes it more palatable. It's not like, oh, another diet. No, it's a dietary intervention. That's fancy. Like, let's go. Like, we're talking advanced stuff here. This is science. All right, here we go. Dietary intervention, a lifestyle intervention, whatever the case may be. Let's talk about if a person really wants to take control of their health. It seems to me like, because you painted a picture beautifully of how, the fat builds up and gunks up the cells and the organs, and and just wreaks havoc on your system here. It seems to me then a diet that is very low in fat then may actually be the key to getting the gum out of the lock, so we can start working properly again. Would I be on the right track?
Yes, Chuck, you absolutely are. And research that was done at the Physicians Committee found that when people are put on a low fat plant based diet, and we actually use magnetic resonance spectroscopy to look inside the muscle and liver cells, after being put on a low-fat vegan diet, the fat content in liver cells decreases by 34.4%, and in muscle cells, I believe it was 10.4% over 16 weeks. So we can reverse it. And there was another interesting study that was done that I actually haven't spoken about. It was published in 2007. And they wanted to see, in people who are healthy without diabetes, how do high fat and low fat diets compare if we're looking at fat inside the muscle cells, like we've been speaking about? So they took people, they put them on either a low fat or a high fat diet for 25 days. They had a washout period. They tried the other diets. Everyone got all the diets. And they found that when people were on the high fat diet, they had nearly 2 times the amount of fat accumulating in their muscle cells. And this study, when they said low-fat diet, they were still talking about the 30% of calories coming from fat. So that's not even like the 10% fat diet that we recommend at the Physicians Committee. So it definitely can be improved, and you're absolutely right. plant-based, high in fiber, low in total fat, especially low in saturated fat, are some of the keys for reversing that intracellular lipid accumulation.
All right, well, what does that mean then for low carb diets, which seem to be so heavily prescribed for patients who are just diagnosed with diabetes? You're talking about
Yeah.
carnivore diet, keto diet, all of those are low carb, but definitely way higher in fat. So, what does that mean for a person's ultimate outcome if they go that route?
Yeah, so a few comments on the low carb diet. So, yes, they are effective at short term weight loss and at glycemic control. So, if you stop eating carbohydrates, you're not getting that dietary glucose, your blood sugar levels will fall and you will not have as many episodes of hyperglycemia. So they are effective at reducing blood sugar. They are effective for weight loss, even though a lot of it in the beginning is water weight loss. However, what I will say about these diets, as we just spoke about in that study, when people consume more fat, they're getting more of this fat inside their cells. So, a low carbohydrate diet is not going to fix that intracellular lipid accumulation. And the study that I just mentioned, their high fat diet was only 37% fat. If we're looking at some of these real carnivore, keto, low carb diets, the percentage of fat is much higher than that. And so, you're not treating the root cause. And there are other long term risks of eating these foods that are part of these diets. If someone eats a lot of red meat, processed meat, dairy, eggs, you're increasing your risk of cardiovascular disease, several types of cancer, breast cancer, colorectal cancer, hypertension. The list goes on. And so, does that mean that you're winning the battle and losing the war? Is it worth the short term benefits of reducing blood sugars, but increasing your risk of all these other diseases while you're not actually treating the root cause? The other problem with these low fat diets is that can you really say that you have reversed your diabetes if you're not eating carbohydrates? Let me explain. My cat wants some airtime as well on this podcast. We might have to give her a chance to say hello.
That's all right. What's your cat's name? We'll just introduce her for the sake of the show here.
She's gone. Her name is Fufu. I'm sure she'll be back.
All right.
Um,
As you were, my friend.
Sorry, the one other issue with these low carbohydrate diets is if you're not reversing that buildup of fat inside the cells, the next time that you eat carbohydrates, we often see that people's blood sugars then absolutely skyrocket because they haven't reversed insulin resistance. They've just stopped eating the carbohydrates. So it's kind of like a band-aid rather than fixing the underlying problem. So I'm not a fan of low carbohydrate diets for long-term health and longevity, even though there are some short-term benefits. To me, the long-term risk and not fixing the root problem just doesn't make it worth it, in my opinion.
Let me take a quick detour and just see if we can satisfy my own curiosity here. Why do these low carb diets that are so high in fat? Why do they work short term for weight loss? Is it all water weight? I know that you mentioned that, but are there some other mechanisms like that are happening that would cause a person to lose weight at least initially? How does that work if there's so much fat?
Yeah. So a lot of the initial weight loss is water weight loss. So what does that mean? Well, when we store glucose in our muscles in the form of glycogen, it binds to water. And so when you stop eating carbohydrates, your muscles go to that stored glucose, that glycogen, and it uses it up. And so as we're pulling this glycogen out of our muscles, we're also getting rid of that water. And so you pee a lot of water out when you start the low carb diet. And so a lot of that weight is water weight loss. What you may find with these low carb diets, at least some of the ones I've seen, is that because they're very high in protein, a lot of people find that very satiating. And so they simply eat fewer calories, and that could contribute to the weight loss as well. In addition, when people start these low carb diets, not all of them, but a lot of them are coming from a very unhealthy background diet, the standard American diet, lots of very calorie dense processed foods. And so compared to their initial diet, when they start these low carb diets, they are most likely eating fewer calories than they were at baseline. So again, weight loss is not always an indicator that a diet is healthful. It's just an indicator that it's effective for weight loss.
All right, let's take a look at another diet that is definitely lower in fat, but still, would I believe recommend what they would call healthier fats, and that is the Mediterranean diet. Talk to us about what we know about the connection between the Mediterranean diet and diabetes.
Yeah, so when it comes to diets, I mean, I think a Mediterranean diet is a great option for someone who is not willing to go all the way low fat, whole food, plant based, like we recommend. There was a big trial called the Reverse Diabetes to Now trial, and that included over 400 people that followed a Mediterranean diet for around 2 years. And of the people who were on insulin at the start of the study, by the end of 2 years, 71%, I believe, were completely off all of their injectable drugs. And after the 2 years, around 28% came off all medication entirely. So it definitely is more effective than what people's standard diets are. If you think about the Mediterranean diet, it does include a lot of plant-based whole foods. So people are usually getting more fiber, more servings of fruits and vegetables than they were before. So it definitely can be a good option. Can a whole food plant-based diet be even better? I would say so. From what I've seen, from the research that I've seen, getting that fat even lower, cutting out the fish, cutting out the lean meat, that extra bit of dairy and eggs that we find in a Mediterranean diet may help to improve people's glycemic control even further. So it's a great option, especially if someone is brand new to plants and they don't know what to eat. Can we make even more progress with a low-fat vegan diet? I believe so.
Yeah, olive oil also in the Mediterranean diet, and I know that in our community that is a hotly debated topic. Just in terms of diabetic prevention and reversal, it is definitely a high-fat food. So, what would you say to somebody who's like, "Oh, olive oil is healthy"?
Yeah, olive oil can be a bit of a tricky one, a bit of a polarizing one as
Third
well.
rail, tread lightly here. Tread lightly.
We have the SOS free community, we have the Mediterranean community. I think I'm somewhere in the middle between that. I think the evidence is very, very clear that if you replace saturated fat with unsaturated fat coming from something like olive oil, that your metabolic health improves. So if you're taking butter, for example, you're replacing it with olive oil, your health is going to improve. I know there's controversy about that online, but to me, it's very, very clear cut. For someone who has type 2 diabetes and is trying to lose weight, remember oil is very calorie dense, so it is going to be adding extra calories to your diet. If weight loss is the goal, cutting out oil can improve weight loss, therefore can improve blood sugar control. Again, it's better than something like butter. Is it okay in small amounts? I would say try it out and do a personal experiment. From people that I've worked with and the research that I've been involved in, I have found that when people have a single meal that's extra high in fat coming from oil, they see that for a day, even up to 2 days, all of their postprandial blood sugars are higher than what they were in the start. So depends on what you're comparing it with. Is it better than butter? Yes. Is it better than no oil at oil? No oil at oil, no oil at all. I would say if you're struggling with your blood sugars and you're trying to lose weight, cut it all out, and then you can gradually introduce a little bit to your diet, see how your body reacts. That's what I would say to that.
Oil and oil. Oil.
Puzzled.
All right. Let's take it all the way over to the NHA space here. Okay, the NHA is all about SOS free. All right, no salt,
Okay.
no oil, no sugar. Obviously, then you get into the 100% whole food, plant-based diet, both in terms of risk reduction and potentially even reversal. Is this truly, in your opinion, as somebody who has studied this extensively, is this truly the gold standard for diabetes treatment in terms of that nutritional intervention?
Low-fat plant-based diet. Are you asking, is that the gold standard?
Indeed, I am, my friend.
Oh, yes.
SOS free
Yes,
at
I
that.
would say
Yes.
so. Yes, I would say so. Dr. Barnard has done some really remarkable research when it comes to diabetes, with a low fat vegan diet and comparing it to other diets like One of his studies, he compared it to portion control. So that's what was being recommended by the American Diabetes Association. So eat the same foods, kind of stay healthy, but just reduce your portions. And when people followed the low-fat vegan diet, they reduced their medications by 43%. Their A1C dropped by 1.23 points in those who didn't have medication changes. And just to put that into context, if someone starts metformin, which is, the initial drug you give to someone who's diagnosed with diabetes. If someone starts metformin alone, monotherapy, their A1C drops by around 1.1, I've seen on average. And so with a low-fat vegan diet, we can actually see A1C drop by even more than if we were to prescribe metformin, which is truly remarkable. The fact that diet can have a bigger effect than medication, it still blows my mind. So based on that, based on what we've seen, I would say absolutely a plant-based diet is the gold standard.
And again, just to kind of revisit here, that's a plant-based diet with whole grains, with fruits,
Yes.
the foods that you are told initially, most often, not to consume. And that has to do primarily with the fact that you're not gunking up your fat cells with a whole bunch of fat. You're not gunking up your organs.
And a question that was actually asked me this morning at the Lifestyle Medicine Conference was from a woman who said she started to try eating this plant-based diet, but she found that her blood sugars jumped up immediately. And so she said she couldn't go without adding animal protein to her meal because her blood sugars were simply too high once she started trying a plant-based diet. And that is something that at least I have seen quite a lot for someone who goes from their standard diet, shifts over to a whole food plant-based diet, low in fat, high in carbohydrates. They may see that their blood sugars are slightly higher than normal at the start. The reason why that happens is because you're adding more carbohydrates into your diet, but you still haven't gotten that fat out of your cells. And so one of the ways to counteract this is to go low fat first before adding in lots of carbohydrates. So before you start adding a ton of rice and potatoes, try cut back on the oils first. Try slowly get that dairy out of your diet. And so you become more insulin sensitive before adding a lot of carbohydrates to your diet. And the other thing is we've seen it just takes time. Yes, your blood sugar levels might be a little bit higher than normal once you start, but I've seen this happen over a week, 2 weeks, 3 weeks, 4 weeks. As people regain their insulin sensitivity, their body becomes better at handling those carbohydrates, and foods that they couldn't dream of eating at the start, like a big bowl of oatmeal, now suddenly they're having no problem with it 3-4 weeks down the line because they just stick with it. So you do have to have some patience. You do have to trust the process and monitor those blood sugars. But when people stick with this, I haven't really seen anyone who's not improved at all on a plant-based diet.
You mentioned dairy, so let me throw you a little bit of a curveball here. What if somebody switched from whole milk to skim milk, and that's obviously supposedly has no fat in it? What do we know about the connection between fat-free dairy and diabetes risk?
I would say that it definitely would be better because it is lower in fat and it would be lower in saturated fat. So do I think that low-fat dairy or non-fat dairy is better than full cream milk? Yes, I do think that would be better for type 2 diabetes, for overall health. Can we cut it out completely? I would say so. It's not necessary for human health. I would say something like soy milk is going to have much more benefits than non-fat dairy. So I would say cut it out completely, but if we're comparing whole milk versus non-fat milk, I would say the non-fat milk would be better.
Is there a plant-based milk that you would recommend more than another? I mean, soy milk's going to have a trace of fat. Any nut-based milk really will. Yeah. Is there one that you think is better than another for somebody trying to get their blood sugar under control?
I love soy milk. I think it's great. It has those extra phytoestrogens. So again, with nutrition, you have to think about everything. So even though we're talking about diabetes now, if a woman has diabetes, she's at risk of breast cancer. Men too, but women have higher rates of breast cancer. And so adding soy milk in place of dairy is going to reduce the risk of breast cancer because of the phytoestrogens in it. And so I love soy milk because of the phytoestrogens. It is generally higher in protein than the other ones. Always try and opt for an unsweetened version so you're not getting those added sugars. And usually they are pretty low in fat.
All right, let's talk about some other foods that you really might want to key in on here. You mentioned whole grains earlier, but if you were going to pull out your prescription pad and give it to a patient, but instead of prescribing metformin, it's just a list of foods, what would be the ones that you put on there to get somebody going?
All right, I would have to say my top food would be adding more beans. And this is because of the second bean effect. Some people listening to this may have heard of this. If you haven't, if we take people and we give them the exact same meal, but in one meal we add beans, we see that in that meal, their blood sugars are lower, and in the following meal, even if they don't have beans in that following meal, that's why it's called the two meal effect. And so we see that beans are really, really great at managing blood sugars. Part of it is due to the fiber in it. Part of it is probably due to some of the other minerals in beans. We're not quite sure, but beans are fantastic. And if you want a little extra boost, especially if you're having something like sweet potatoes or oatmeal, adding some cinnamon has actually been found to lower postprandial glucose. So add a little sprinkle of cinnamon on top of your food, and for some reason it works. I'm not quite sure why, but that is for some bonus points.
Huh. Is there a particular kind of bean? A black bean, a kidney bean, a black-eyed pea? Like, what bean would you recommend, Doc?
Maybe not the black-eyed peas, but all beans are equal in my eyes. We see that beans that are darker in color, so beans like black beans, red kidney beans, they typically have more antioxidants in them. So black beans are actually the bean that has the most antioxidants. Why are antioxidants important? Well, they help to fight chronic low-grade inflammation in the body. And something we haven't really spoken about is the role of inflammation in insulin resistance. And so we do see that that inflammation does play a big role in insulin resistance. And it's linked to having that excess fat. So when we have that excess subcutaneous fat, remember those cells are not just sitting there doing nothing. And we see that they are associated with low-grade inflammation, which worsens insulin resistance. So if you have to choose a bean, something like black beans or red kidney beans, where you're getting the fiber, you're getting the protein, and you're getting extra antioxidants, would give you bonus marks in my book. But honestly, if people eat any bean, I would be happy, because most people are not eating beans at all.
Would you consider like hummus to be a bean? Because I mean, hummus to me should always be its own food group. And I just want to make sure that we're doing the right thing by eating copious amounts of hummus, maybe even black bean hummus.
Hey, I have not tried black bean hummus, but I'm sure it's delicious.
What? Hold on. We got to stop the show and we got to go get you some right now. Like, it is a life-changing event.
I've never seen that.
Are you serious right now?
I mean, yes, I am serious. I've never seen black bean hummus.
Dr. Becker.
All right. That's what I'm doing today.
As we record this, it's a Friday. You got all weekend to just change your life. And that's what's going to happen here. Like wholesale changes. Wholesale changes. You're not going to be the same person when we come to work Monday morning.
I've never seen it in stores before.
Well, you might have to make your own. You have a food processor? That's all you need.
Yeah.
Food processor, some chickpeas and black beans.
I usually add butter beans to chickpeas when I make homemade hummus, because that makes it a little extra smooth and creamy. And so often if you make your own hummus at home, doesn't quite compare with store-bought hummus, and that's because we don't get it smooth enough. We don't add as much sugar and oil as they do to a store-bought hummus. So adding some butter beans can help you to lower the amount of oil that you add and still get that really nice smooth texture. So that's a hack for you. If you're not adding black beans, add some butter beans.
That's Dr. Roxie Becker, culinary MD. Well played. Yeah.
I like the sound of that.
So speaking of antioxidants, if we were to say, is there a fruit that's particularly more beneficial than another, kind of along the same line of questioning with the beans? I mean, Dr. Barnard really bangs the drum for blueberry. Are you on the blueberry train?
I was just about to say.
Yeah.
In general, anything that's brightly colored is going to have more antioxidants, because if we think about what antioxidants are, beta carotene is an antioxidant. That's what gives carrots their orange color. It's the anthocyanins in blueberries, the chlorophyll in leafy greens. And so anything that's brightly colored is generally going to be more packed with antioxidants. So yes, lots of berries, blueberries, blackberries, strawberries, get them all in.
All right. I know that you are really an active individual. Like you like to run. I know that you like pickleball. You spend time at the gym. Like you're always on the go. Um, let's talk about exercise, though, in terms of diabetes prevention reversal. We've talked a lot about food, but let's look at this other pillar of lifestyle medicine here. How important is it for a person to stay active as they're trying to, again, bring their blood sugar back under control?
Yeah, so when it comes to prevention, people who engage in regular physical activity generally have around a 30% lower risk of developing type 2 diabetes. And no, that doesn't have to be in the gym. Getting around 2.5 hours per week of brisk walking where you're missioning along, you're not just going for a casual stroll, has been found to lower the risk of diabetes by around 30% as well. So any exercise is better than none. And yes, it does play a role in diabetes prevention. What's also really interesting is that it's not just aerobic exercise, but resistance exercise is also important, and building muscle mass is also important. We've spoken about this on an exam room episode. You know, I'm all about building muscle mass. And the reason why I say this is because if we look at data from the National NHA, I never remember the abbreviation, National Health and Nutrition Examination Survey. I hope I'm getting
Well
that.
played. Well played.
um, National Health and Nutrition Examination Survey. That's the one. So this was a study done in the US. It was a cross-sectional survey, over 13,000 people, and they looked at body composition. And when they divided these people into quartiles based on how much muscle mass they had, those who had the most muscle mass had around a 63% lower chance of having diabetes compared to those who had the least muscle mass. Why is muscle mass so important? Well, after our brain, our muscles are our biggest utilizer of glucose. So you can imagine if you spill some water on the counter, if you have a small sponge or a big sponge to soak up that water, what's going to be more effective? The big sponge. So adding muscle onto your body, having more of this muscle mass, gives you more cells that can take up this glucose. So we see that it is important for prevention, but also for diabetes management. And there was one study that was really interested that looked at exercise timing. So a lot of people don't have access to a gym. They maybe can just go for walks. And so this study took people with type 2 diabetes and they wanted to see what is more effective, walking for 30 minutes once a day or walking 10 minutes 3 times a day after each meal. And they had to start walking within 5 minutes of their meal. So they finished eating breakfast, they had to put the plate down, run to the door and go for a 10-minute walk. And they actually found that breaking up the activity, especially after meals, improved blood sugar control more than just getting it in one shot in the day. So that's a great hack as well. If you're someone who has a big meal or has a meal high in carbohydrates, or for whatever the reason, you see that your blood sugars are really high after eating a meal, going for a quick 10-minute walk immediately after eating is a little hack that can help you to bring down your postprandial blood sugars.
Yeah,
So
that's wild.
to be slaving away in the gym, even walking is really helpful.
Yeah, man. I mean, when I first took charge of my health, walking was my exercise, and it worked wonders. Like mentally, physically, like every way imaginable. I just felt good about it. Breaking it up,
It's
though,
good to get out in nature as well, because that's also good for your mind. Stress plays a role in blood sugar control as well.
for
And
sure.
all over. Get
Well,
outdoors.
but the idea of breaking it up, 3 times a day just for 10 minutes, that's something that virtually everybody can do.
Yeah.
But it kind of reminds me of like we've been hearing more and more and more about the benefits overall that come with like interval training. And I'm curious as to why that would be as opposed to like getting everything in one big shot. I mean, some of that I'm sure is like just hypothesizing and spitballing here, but like if you were just to take a stab at, why we see such benefits in exercising in smaller chunks more frequently versus that one big dose, what do you think is going on there?
Are you talking about like the weekend warriors? People who don't exercise during the week and then suddenly do 5 hours in the weekend?
Right. Or there's that. There's also the idea of like interval training with, your walks and your runs. Like you break that up. It's like you walk for a minute, you walk, then you run, You walk,
Mm.
you run, you walk. Like, it just seems like breaking things up, shaking things up, as opposed to doing like one big, long, sustained thing seems to be the new trend. And the more data that comes out on this, it seems to be there's more and more benefit. So, again, it's not my area of expertise, and this is just me throwing you another curveball, but it is kind of a fascinating thing to think about. Like, what is it about these smaller chunks that make them so beneficial?
I'll say a couple things about it. The first is if we're looking at the weekend warriors, why they don't tend to do as well is that they've then just got so much more sedentary time during the week. First of all, like we've seen, we need that regular break in activity for our body to be at its best metabolically. So they're getting a lot more sedentary time during the week. And the other thing is when you're trying to cramp so much exercise into 2 days, what happens? Well, you're probably going to get injured if you go from not doing anything to suddenly running a half marathon on the weekends, which is typically what I do, which I don't recommend. You're much more likely to get injured. And when you get injured, then you're out for 2, 3 weeks. And then that's more time that you're not exercising. And even when we just look at the research on the health outcomes, the all cause mortality, people that regularly get exercise tend to have lower rates of chronic disease and of dying. When it comes to diabetes and getting regular exercise, I can add something else here. We see that, remember, I spoke about those glucose channels in the cells that get the glucose into the cells. So when you exercise, it actually increases the number of these channels by around 22% if you follow a training program for 8 weeks. And so you have more channels that are able to open up, get more glucose into the cells. So we see that those benefits can last around 48 to 72 hours, which is why if you look at the American Diabetes Association's exercise guidelines, they say do not go for more than 2 days without exercise because you will see the benefits start to drop off. When it comes to your question about high intensity interval training versus endurance training, both are important for different reasons. I think one of the reasons why HIIT is becoming so popular is firstly because it is the best way to increase your VO2 max, which we spoke about on another episode. And that's a really, really good marker of cardiovascular fitness. So pushing your body to its absolute maximum, which we can't do for an hour because we drop out and die, pushing your body to its maximum really improves your VO2 max more than just doing steady state training. And the other thing is we actually see that high intensity interval training is better at reducing visceral fat, that fat around the organs that I spoke about, than doing long, low intensity exercise. So there are benefits to both. I think both should be included in training programs. And again, make sure you're exercising at least every second day if you can.
All right, let's dot some I's and cross some T's here as we wrap up. I want to talk about the rates of diabetes, which are continuing to surge as our diets, despite the fact that we are health crazed as a nation, supposedly, the rates of diabetes and other chronic illnesses really continue to go up, as do our waistlines and all of that. So I guess my question is, like, if we as a nation here in the US anyway were to adopt the changes that you're talking about, gravitated more toward that whole food, plant-based, SOS free diet, what do you think would happen to the rates of diabetes that we're seeing currently and our projections that show that they're going to continue to explode at least for the next couple of decades?
I mean, in an ideal world, yes, if everyone adopted an SOS-free, whole food, plant-based diet, got their regular exercise, I think the rates of diabetes in America would absolutely plummet. Getting people to actually do that is a whole other different story. But yes, if I was the, what's it called here, the Health and Human Secretary, what's what's that title?
The person in charge of healthy stuff.
Exactly.
Yes. Yeah.
Then yes, I would promote the benefits of a whole food plant-based diet. We need to get the crops more subsidized so it can become more affordable for people. At the moment, there's so many financial subsidies that are going to animal agriculture, and that is making meat cheaper, vegetables more expensive. There's so much change that needs to happen on a policy level, on an education level, on an individual level, on medical school education. There are just so many different places where we could have an effect. But absolutely, if everyone ate more plants, moved more, slept better, stressed less, the rates of diabetes would absolutely plummet.
HHS, Secretary, Health and Human Services.
There we go.
But let's drill down. Let's go from that communal approach to a community of one. And honestly, that is where major communal changes happen anyway. It starts with one person, which again is why I'm wearing this hat, the Never Give Up hat. So give me the good stuff here, Doc, as we wrap up. If somebody comes to you, they're a patient, they've had diabetes for a number of years, they're tired of feeling sick, they're tired of feeling tired, they're just tired of not being themselves any longer, but they feel lost, they feel hopeless. What message would you have for that patient?
I would say never give up, because it's never too late. There was a case series published in India where they took 59 people, put them on a low-fat, plant-predominant diet, and within a year, or I think it was 44% of them went into absolute remission, normal blood sugar levels, no medication. What was the average age there? 71 years old. It is never too late to make a difference. And don't underestimate yourself. If you just try it, you have no idea how good you can actually feel. And what I always say to people as well who are nervous of making a change, try it for 4 weeks, go all in. Take it like an antibiotic. If you hate it, you can always go back to the same way of eating. But what people find is if they just give it a try, they see their blood sugar levels improve, they start coming off their medications, they have so much more energy, they feel so much better, that they are so grateful they just gave it a chance. So give it a chance. Have grace on yourself when you mess up. Have faith that you can do it. And it's never too late to make a change.
Dr. Roxie Becker. I love that. That's the perfect way to end the interview. Thank you so much for your time today. We've got links to your social media and where people can get in touch with you. That's down below in the show description, the episode notes. But you are a true rock star. Thanks for sharing your wealth of wisdom with us.
Thanks, Chuck. Thanks, NHA, for having us here.
Thank you for joining us on the NHA Today podcast. Subscribe and follow the National Health Association on YouTube and social media for the latest in plant-based science and healthy lifestyle support. For more resources, articles, and information about our membership and conference, visit healthscience.org. Until next time, here's to your plant-powered health.